2 hours after ejaculation. Fertilization usually takes place in the distal third of the fallopian tube. After fertilization, the zygote divides into multiple cells. Meanwhile, it is traveling into the uterus, where it will burrow into the innermost segment of the endometrium, a process called implantation. About a week after ovulation, the fertilized ovum has exceeded 100 cells, at which time it is known as a blastocyst. It continues to undergo growth and differentiation, eventually becoming a fetus about 8 weeks after fertilization. The process we've described so far, from the point of conception onward, is of course the initial phase of pregnancy, the time between conception and birth. The total length of time from conception to birth is called gestation, typically 280 days or 40 weeks. Naegele's rule is the most commonly used formula for calculating the estimated date of confinement, or EDC, also called the due date. Starting with the first day of the client's last menstrual period, or LMP, then moving forward 7 days, and counting back 3 months, you will arrive at the client's EDC. Now, for example, if the LMP was January 17th, add 7 days. This should be January 24th. Then subtract 3 months and you will have October 24th. This is the client's estimated date of confinement. The many physiological changes of pregnancy are responses to shifts in the hormone levels, specifically human chorionic gonadotropin, or HCG, estrogen, progesterone, human placental lactogen, and relaxin. With the exception of HCG, the placenta produces all of these hormones. HCG is produced by trophoblastic cells, specialized cells of the blastocyst. This hormone helps maintain the pregnancy until other placental hormones take over the responsibility. Detecting HCG in maternal blood or urine indicates pregnancy. You can categorize the signs of pregnancy within 3 general areas. Number 1, presumptive. Signs that suggest but do not positively confirm pregnancy and could be due to other conditions. These signs include the absence of menstruation, nausea and vomiting, breast changes, urinary frequency, fatigue and quickening, and awareness of fetal movement, often described as a fluttery feeling. Number 2, probable. Strong indicators of pregnancy, not likely, but still possibly due to other conditions. These signs include abdominal enlargement, Chadwick's sign, a purplish or bluish tinge of the vulva and vagina, Hager's sign, a softening of the lower uterine segment, Goodall's sign, a softening of the normally firm cervix, ballottement, a rebound movement of the floating fetus, Braxton Hicks contractions, irregular, painless uterine contractions, palpation of the fetal outline, and a positive pregnancy test, HCG, and then finally, positive. Signs definitively confirming pregnancy. These are fetal heart tones, fetal movement felt by the examiner, and ultrasound evidence of a fetus. The many signs and symptoms of pregnancy reflect anatomic and physiologic changes. Increases in estrogen and progesterone are responsible for several reproductive system changes. The breasts enlarge, become full and tender, have darkened areolae, and leak colostrum after the first few months of pregnancy. The uterus expands because of enlargement or hypertrophy of myometrial cells and distension from the growing fetus. Braxton Hicks contractions, which are regular, painless, and commonly become more frequent and apparent toward the end of pregnancy. Endocervical glands increase cervical mucus production, eventually forming a protective mucus plug that is later expelled as the cervix begins to dilate. Vaginal mucosa thickens and vaginal folds become more pronounced, and vaginal secretions become more acidic, creating an environment that increases the risk of candidiasis, or yeast infections. Moving on to other body systems, we'll consider the musculoskeletal system changes attributed to the hormone relaxin. Ligaments in the symphysis pubis and the sacroiliac area soften, and these joints become more mobile. A shift in the center of gravity over the extremities pulls the bony pelvis forward, accentuating the lumbodorsal spinal curve, often resulting in low back pain. This alteration in posture, called lordosis, can also cause strain and aching in the upper extremities, neck, and shoulders. The cardiovascular system undergoes significant change. Blood volume increases 30 to 50%. Cardiac output increases. Blood flow increases to the organs supporting the fetus. And the pregnant woman's pulse rate tends to increase as much as 10 to 15 beats per minute. Red blood cell mass increases during pregnancy, but not as much as blood plasma volume does. As a result, anemia is common. But keep in mind, it is not a true anemia, caused by physiologic changes, and not by pathology. White blood cell counts also increase, by an average of 10,000 cells per cubic millimeter. A very common problem during pregnancy is edema of the hands and ankles, related to venous stasis, and mild to moderate to severe varicosities are not uncommon. Supine hypotensive syndrome is another possibility. It is caused by pressure of the growing fetus on the pregnant woman's inferior vena cava when she lies on her back. Symptoms of this phenomenon include a drop in blood pressure, dizziness, and pale, clammy skin. Be sure to instruct your pregnant client that she can relieve these symptoms when lying down for rest or sleep by turning on her left side or using a wedge under her hip to tilt the uterus laterally, thus relieving vessel compression. Deep breathing sometimes becomes increasingly difficult for the pregnant woman as the fetus continues to grow and estrogen levels rise. The pregnant woman becomes a chest breather and has a tendency to hyperventilate. Her lower ribs flare out, her diaphragm is displaced upward, and her chest increases in size 5 to 7 centimeters. Shortness of breath and nasal stuffiness are common. The first trimester, heralded by the well-known gastrointestinal symptoms of nausea and vomiting, brings several changes for the pregnant woman. Her gums appear red and swollen and bleed easier because of the elevated estrogen levels. The reduced tone of the esophageal and cardiac sphincter allows reflux of acidic stomach contents, resulting in heartburn. Decreased motility allows more water to be absorbed from the gastrointestinal tract, causing constipation, which increases the risk